Hi, everybody. So, long-term care homes and retirement homes have been very much in the news, and it's certainly a huge tragedy that we've had so many cases and particularly severe illnesses and deaths in these homes. There is a lot proactively happening to try and prevent infection in these places, and I'll outline a few of those measures here. So, first off, before anyone can enter one of these long-term care homes and retirement homes, there's a screening process to make sure people coming in don't have infection. And so we're making sure nobody with infection is bringing that infection to these homes to make sure everybody inside the homes remains protected. Second, everybody in the homes should be wearing some level of personal protective equipment at all times. And that equipment becomes enhanced when there's an outbreak or they're dealing with persons who have an infection. The provinces prioritize making sure these homes are getting personal protective equipment first, seeing how many cases we've had in there. So they should have the equipment necessary to protect the workers there, as well as protect all of the residents in these homes. Similar to other locations, our long-term care homes are taking extra measures to make sure they're disinfecting areas frequently to kill any virus that might have found its way into the home. We've of course seen the province has disallowed workers in long-term care homes from working in multiple locations, and that hopefully will prevent infection going from one place that is in outbreak or does have cases to another place that maybe doesn't, and that's an extra measure to keep infection out. We're also starting a process provincially where we're doing what we're called surveillance testing, which is we're going in, we're testing staff and testing residents who have no infection just to see, are we picking up anything in case someone maybe has mild illness they haven't talked about or maybe had illness with no symptoms. So we hopefully are identifying this early and we're identifying people who might have illness and stopping the spread of infection before it has any opportunity to transmit in the home. And lastly, there's lots of work happening by us in public health to be going in, observing and inspecting the infection prevention and control practice to make sure that they are pristine, and providing coaching and education where we do see gaps to make sure that our homes are able to have the best protection in place for their residents and for their staff.